For our next post-rehab tip segments, we're going to look at the menisci of the knee. Now, I have a knee model here, and this is just an anterior view of a knee. We have our quadricep, our patella, our quadricep and patella tendon, our medial collateral and lateral collateral ligaments. And if we now remove the quadricep, actually we're going to move this down here out of the way, along with now flexing the knee, we can now start to see the condyles here, the femoral condyles, and here we can see the menisci. So now we have the lateral meniscus and medial meniscus. We're now going to go to another model. And with our model here, what we're doing is we're looking right down on top of the tibial plateau. Now, here's our orientation. This is the lateral aspect of the knee, and here's our medial aspect of the knee. We know this is the lateral aspect because here's our fibula here, and over here obviously would be our medial meniscus, our medial collateral ligament, our lateral meniscus, and our lateral collateral ligament. So now we're going to look down. This is going to be looking down on our tibial plateau, and you can see here, there are our menisci. Now, if we look here, this is our lateral meniscus, and here's our medial meniscus. And notice these are semicircular. They're C-shaped structures, and these act as shock absorbers in the knee. Our medial meniscus, as you can see here, is the larger of the two, just slightly larger, and it also bears slightly more weight than the lateral meniscus. The key thing here to understand is only the outer portion, just the outer portion, the very outer portion of the menisci. Hopefully you can see where I'm actually tracing that. That's not such a great job of tracing, but only the outer portion, the very periphery of these menisci, are vascularized. Well, what that means is they have a blood supply. As a result of only a small portion of the meniscus being vascularized, roughly 1 or 2%, we find that tears of the menisci are significant in that the meniscus themselves don't heal. Without a blood supply, they won't heal. So if you would please understand, we have two menisci, medial and a lateral menisci. For the most part, they're avascular, and along with that, the medial meniscus bears more of the weight, just slightly more. It's the larger of the two. It's the more frequently damaged of the two, but we will see significant damage in both of these menisci. And most of the tears we'll see are going to be along the posterior aspect. So from where my pin is, moving posteriorly is where we'll see most of these tears. Okay? So remember, the menisci are not going to 100% heal, and that's due to the lack of vascularity in the majority of it. Roughly 98% of it is avascular, and as a result of that, we don't see true healing of the meniscus. Along with that, we know for sure that for the most part, for individuals over the age of roughly 19 to 21, we cannot produce new cartilage. So here are our two menisci. Again, medial, lateral menisci. These are primarily shock absorbers in the knee, and please remember, these are the two most important structures in the knee. The old line that I've heard from orthopedic surgeons is, meniscal tears end careers, but ACLs can be reconstructed.